Inosi Life Sciences is a biotech company which combines both innovation and experience to develop the next generation of therapies for millions of patients with autoimmune disease, acute inflammation, and cancer. The company is founded by world-renowned scientists Professor Sir Mark Feldman and Dr. H. Michael Shepard, pioneers who have developed some of the most successful and profitable treatments in the fastest-growing drug class in the world, monoclonal antibodies. Feldman developed the first antibody to treat inflammation, and now TNF blockers are a $40 billion industry. Shepard developed the first anti-cancer antibody, Herceptin, selling $9 billion per year. Both Lasker Award winners, Feldman and Shepard are pioneering leaders in biotechnology with a track record of success. And now they're combining their talents, networks, and expertise to develop novel treatments that improve on their past success and augment drug efficacy while reducing side effects. Cancer and autoimmune disease both result from failures of the body's own immune system and share a common trait: inflammation. Short-term or acute inflammation is a helpful part of the immune system's response, but in autoimmune diseases and cancer, the inflammation fails to switch off. In autoimmune disease, there is tissue damage. In cancer, there is excess cell growth. In both cases, there is cell invasion. Inflammation occurs when cells are triggered by any injurious assaults, such as invading pathogens or burns, and these cells release local messenger protein molecules known as cytokines. Cells use cytokines to talk to one another. Each cytokine can be considered like a key which binds to a lock on the cell surface called a receptor and activates it. The key cytokine in inflammation is often TNF, as it triggers the release of many other inflammatory cytokines. These cytokines cause the redness in arthritic joints or the fluid in lungs that brings shortness of breath during viral infection.
TNF plays an important role in regulating inflammation, and depending on how it binds to a cell, the result will be different. When it binds with TNF receptor 1, it promotes an inflammatory response. When it binds with TNF receptor 2, it activates an anti-inflammatory response.
Existing antibody therapies bind to TNF, blocking it from binding to both TNF receptors. These antibodies are best sellers because by preventing TNF from binding to receptor 1, they reduce inflammation in diseases such as rheumatoid arthritis and inflammatory bowel disease. But by stopping TNF from interacting with receptor 2, the body's repair system is not engaged, so patients have partial benefits with some side effects. Inosi Life Sciences is creating an antibody that exclusively disables TNF receptor 1. This allows TNF to activate receptor 2, reducing inflammation and preserving immunoregulation, and this has been proven to work in animal models in Dr. Feldman's lab. Inosi is also developing other novel therapies that can be used in both rheumatoid arthritis and cancer. Dr. Shepard became famous for developing Herceptin, a monoclonal antibody blocker of one receptor termed HER2. However, there are other members of this receptor family that bind many related cytokines. Shepard has designed a pan-HER ligand trap, which traps or targets 9 inflammatory growth factors that contribute to cellular proliferation and invasion in rheumatoid joints and tumors. This therapy has already been tested successfully in cancer and rheumatoid arthritis models. Autoimmune disease affects 20% of the population around the world, and it's 4 times more likely to occur in women. Cancer kills 10 million people every year. The TNF inhibitor market is huge, $40 billion, and the cancer therapeutics market is even bigger. With a leadership team including Chairman Dr. J.N. Woody, along with deep experience developing, marketing, and commercializing drugs, Inosi will leverage its substantial academic, regulatory, and institutional networks to develop treatments efficiently and cost-effectively. This is your chance to join them and get in on the ground floor of this remarkable opportunity. Invest in progress. Invest in scientific innovation dedicated to making patients better. Invest in Inosi Life Sciences.